A major healthcare provider also seeing employee protests. Workers across California have walked off the job at Kaiser Permanente. KPIX 5 Susie Steimle is live in South San Francisco with the reason and how it's disrupting patient care. Susie?
That's right, Liz. It's day 3 of the strike here at Kaiser, and they are no closer to any kind of an agreement between Kaiser and the union. And now nurses are headed out to the picket line to show their support and stand in solidarity, and patients are getting caught in the middle. Registered nurse Susan Lawrence was supposed to be at work today. Instead, she's on strike in solidarity with her coworkers. Kaiser prepared for mental health workers to be on strike this week. But now that nurses are leaving their posts, surgeries are being rescheduled. Well, what about the patients who need those surgeries that might be getting moved around now?
I think that this is a long-run perspective, not about this week. I think this is about the health care of many for decades.
Susan says inadequate care for mental health patients can be just as detrimental as pushing a surgery.
We had a community mother, a Kaiser mother, who actually committed suicide during postpartum depression because she, it had to be in part because she couldn't access services to get help.
In a statement, Kaiser apologized to patients, expressed disappointment in the nurses union, and said, "We want to be very clear. If we are unable to accommodate a patient's surgery in 2018 due to this strike and reschedule it for 2019, there will be no financial penalty." Adequate mental health care is an ongoing issue for the healthcare company. Kaiser even had to pay a $4 million settlement to the state for deficient mental health care in 2017. Psychologist Matt Hannon says they're still not keeping up with demand.
It's very frustrating when I cannot book a patient with an initial face-to-face appointment for 5 or 6 weeks.
Kaiser has also been critical of the timing of the strike, saying the holiday season can lead to spikes in depression.
It's something of a myth that there's more psychiatric distress during the holiday season, but it is absolutely true that Kaiser provides substandard care every day of the year.
Now, Kaiser has been adamant throughout the week that they say at the bargaining table, all of this is about money. Of course, the employees who are out here on the picket line dispute that. Kaiser, though, went on to point out that the majority of those employees make 6 figures. Liz.
All right, Susie, thank you.